And so let's make sure we have our terminology correct. This little dip right here, what's that called?
The cubital fossa.
Cubital fossa, exactly right. Different than what's right over here, which we sometimes call the funny bone. That's the cubital tunnel. Okay, so this is testing for cubital tunnel nerve entrapment. It's the ulnar nerve that gets entrapped. And what you do is you simply hold the elbow like this for a few minutes. And what happens is the patient, the positive finding patient has paresthesias along the ulnar side of the hand. Simple as that. Again, testing for cell phone elbow. But these patients, by the way, a lot of times they'll wake up with symptoms because they sleep like this the whole night through. And in the initial stages of treatment, you might actually have them in a splint while they sleep. So they're not, aggravating that nerve all night long. And basically you tell them about that. So again, it's the funny bone, that's the ulnar nerve in the cubital tunnel. And we'll be talking about that. That's pretty simple, the elbow flexion test. Okay. We're going to add a couple tests here. Look at that. We're going to have one test here. So you can write down the addition of these, this next test as well. Okay, so let's get a little bit more with elbow stuff here to kind of make sure that we're into this completely before we start the next part. Good. If you contract your wrist extensors, you can kind of see the different muscle bellies. And let's think about the anatomy here. Deep to my wrist extensors is my supinator muscle. And the posterior branch of the radial nerve goes right through a hole in the supinator muscle called the canal fros. Let's write that down. It's the radial tunnel. It carries the radial nerve through the supinator syndrome, through the supinator muscle. It's also called the supinator syndrome, supinator muscle. And it's a canal of Fros, F-R-O-H-S-E, not Frosch, Fros, Nula. And so one of the ways we identify this is finding, is it painful? About an inch below the epicondyle. So we should find the epicondyles first. Okay, we've got to find this first on each other. A couple more bony anatomy things. Come on back. Knock things down. Turn facing that way now. Okay. Medial and lateral epicondyle, those are the bony things there. And the olecranon. When I straighten the elbow fully, it should form a straight line. As I bend the elbow, it forms an isosceles triangle. How cool is that? Okay, fancy word. Isosceles triangle. Now, when we look at the epicondyle, let's go around this way now. And again, it's the bony thing over here, is the epicondyle. It's the proximal bony thing here is the epicondyle. When I have epicondylopathies, it's tender right there. If it's an enthesopathy, it's tender right there. But what I want to do is also check the supinator muscle to see, is that tender? And of course, how tender is it becomes the next question. So I come about an inch or two down and feel between the muscle bellies. So if you'll grasp for me. And you can see the different muscle bellies here. Definition, now relax. And I'm kind of just trying to get between those muscle bellies. Is that tender? No problem. Okay, good. And that, so it's about an inch down, maybe an inch and a half to 2 inches down here. And I'm trying to see, is it tender there? And it helps me distinguish, does this person have a supinator syndrome, which is often mistaken for a tennis elbow or an extensor tendinopathy. In fact, it's even called resistance tennis elbow because it doesn't respond as a normal pair. In fact, as we'll learn, one of the treatments for tennis elbow is to give them a tennis elbow strap to compress right in here. And what do you think happens when you compress a nerve entrapment?
It gets worse.
It gets worse, and that's actually one of the clues, is that it can get worse from doing that same exact thing. So I want you to palpate that. Where would that be on my partner? Then I also want you to palpate on the lateral elbow and find the radial head. Now, how do I know where the radial head is? On the lateral elbow, there's two bumps. The proximal bump is the epicondyle. The distal bump is the radial head. And I want to know that I'm on the radial head, and I do that by supinating and pronating. Now here's the neat thing about the radial head. It's not a perfect cylinder. It's kind of ovoid in shape. So when I supinate and pronate, it comes like this. You can feel the movement there, because it's not a perfect cylinder. And so these are going to be two structures I'm going to ask you to palpate with the tip of one finger on the elbow for your test. That's the lateral epicondyle and the posterior radial head. And of course, we've got to find the posterior radial head if we're going to adjust the posterior radial head. So with your partners now, I want you to find the lateral epicondyle, the posterior radial head, and you confirm that